hormones, okay? So there's different concerns, okay? I think this is another thing where I think, unfortunately, the synthetically made products, taken orally for the most part, are the ones that are of the most concern as far as the studies that have been out there. These are larger studies because these were patented drugs. There's been studies since the 70s on estrogens that have actually shown a lot of bad things, actually. There was a Swedish study back in 1989 in the New England Journal of Medicine that basically showed increased breast cancer in estrogens, certain estrogens, the conjugated ones, the oral, the Primarins, this and that. And if you took estrogen plus a progestin, see, there's a difference between natural progestone and progestin. The progestins are medroxyprogesterone acetate. So if you were taking that in combination with estrogen, there was even a doubled risk in that study of breast cancer. There was a trial in 1998 where they studied to look for heart disease and would hormone therapy prevent heart attacks? And it said it did not prevent heart attacks, that it increased risk of a second heart attack. These are the problem with a lot of these oral medications that drug companies are pushing is they're giving estrogen in a very, very, very large amount, number one, okay? Number two, they're not giving it as a stable human-like form. They're adding a hydroxy group. They're adding a medroxy group. They're adding these groups to it to get it patented or whatever. But the problem with that is horse urine-based hormone is not the same as human hormone, okay? But the plant-based, the soy-based hormones that we are using for pellets, much lower dosaging, most uniformly spread out, and there's smaller studies because the FDA won't get involved, but the studies have shown no increased risk in cancers with these pellet therapies. Now, because 85% of lawyers in the world live in this country, there's still the risk and concern about, they don't know what we are knowing about hormone pellets because they're not using them. I have a lot of gynecologist friends that they're like, oh, that's just, that doesn't work or this, that. But they don't give a why to their answers. The answer is they weren't trained in it. They're not doing tests. They're not doing it. They're not doing any studies comparing pellets to pills. And they're not checking levels on pellets. So they're not, when you check levels on pellets and you see a good subtle normalization of hormone values, you see a lot of improvement in how people feel. Because see, there's not hormone just, hey, I've got hot flashes. Because we said low estrogen, low estradiol, high estrogen, and low progesterone, all of that can cause postmenopausal type symptoms, perimenopausal symptoms, not just estrogen alone. So, there was a huge study, especially on the medroxyprogesterone, which is progestins, progestins. That is not progesterone, okay? So when you are seeing people getting on the Proveras and this and that, the medroxy component, there was a huge study that had to be stopped in 2002 because they had estrogen and medroxyprogestin combination. There was a 26% increase in breast cancer. There was a 30% increase in heart attacks. There was a 41% increase in stroke, and 200% increase in blood clots. So what I'm saying is, a lot of these cancer fears, if somebody has no history of cancer, if somebody meets all of the guidelines, they have all of these perimenopausal, menopausal symptoms, and they don't have this just rampant family history of breast cancer and other things, hormone pellet therapy is very safe for those people. Very safe. And I would tell them that. I would be bold to tell them that, because of plant, soy-based, most like humans, and you're using lower, more steady state dosages, and you're following their levels.
For more, visit empiremedicaltraining.com. Go to our calendar and review all topics and dates available. Don't miss this great opportunity to ramp up your practice from the comfort of your home or office. Don't forget to subscribe to our YouTube channel to stay updated on the latest news in the aesthetic field.